The moment you see two pink lines, everything changes. Your heart races. 1,000 thoughts flood your mind. You rush to your first appointment, expecting answers. You're handed some test forms, basic instructions, a follow-up date. But instead, there's so much they don't tell you. In today's video, we'll uncover 5 things your doctor almost never mentions during pregnancy. But every mom deserves to know. These insights can reshape how you experience this journey. Stay with me because the last one, it might just change how you feel about motherhood entirely and not even known why. Some days you might feel numb, others overwhelmed by fear or even guilt, because you're not glowing the way everyone says you should. 1. Your emotions matter just as much as your blood pressure. Have you ever cried during pregnancy? They focus on lab results, ultrasounds, fetal growth, losing interest in daily life. It's not just hormones. And you're not alone. You deserve support, not silence. But when you feel disconnected from your pregnancy, like you're just surviving, not celebrating, that's a valid experience, and you are still an incredible mother. They feel sick, exhausted, frustrated, even resentful. And that doesn't make them bad moms. Here's the truth. No one says loud enough. Your mental health shapes your baby's development, especially their brain and stress systems. Like orange juice. Great for vitamin C, but terrible if you have acid reflux. That deserves more than a one-size-fits-all list. Every pregnancy is different, and your body might need something totally unique. But the truth? Prenatal depression is real, but it's often brushed off. Many doctors don't ask how you're feeling. But if you're anxious all the time, unable to sleep, but you're not weak, you're not dramatic, you're just human. 2. Pregnancy isn't always magical, and that's okay. No one else feels the kicks, the backaches at 3 a.m., the sudden panic when your baby hasn't moved in 2 hours. Only you. We're told this journey is sacred, that carrying a baby is pure joy. But what if it's not? What if you feel miserable? But bonding isn't always immediate, especially if you've had trauma, anxiety, or even just a tough pregnancy. Here's the truth. Many women struggle not because they don't matter, but because there's not always space to say them. Maybe they don't want to scare you. Maybe they think it's just normal. You're not broken, you're honest. And that honesty is the start of real love. If any of these moments felt familiar, drop a comment. Your story matters here. Another might struggle with low iron or gestational diabetes, even if she eats perfectly. But doctors rarely say this out loud. 3. The perfect pregnancy diet doesn't exist. You probably got a printed handout. Eat more greens. Avoid sushi. Take your vitamins. One mom may need extra protein, and what works in trimester 1 might backfire in trimester 3. Doctors don't always have time to personalize your nutrition, but you can ask for a tailored plan. Your baby's growing inside you. 4. You might feel completely alone, even with a loving partner, even when your family checks in, even if friends throw you a baby shower. Because the truth is, no one else is carrying this baby. And that kind of loneliness, it's hard to explain. That's why many moms feel guilty, like they shouldn't complain. Miss our next video. What no one tells you about the first 3 months after birth, it could prepare you in ways no checklist ever will. Unfortunately, doctors rarely ask about emotional loneliness, but acknowledging it can be powerful, healing, and deeply important. 5. You might not fall in love with your baby right away. We all picture that magical moment, seeing your baby on ultrasound, feeling instant love. But for some women, it doesn't happen. Maybe it takes weeks, maybe months. And that's okay. Doctors often don't prepare moms for this. Loving your child isn't a light switch. It's a relationship, one that grows. So if you don't feel deeply connected yet, don't panic. You've just heard 5 truths, ones that most prenatal appointments never cover. But here, with us, you have that space. Thank you for watching until the end. And if you want to keep exploring the real side of motherhood,